Mental health is not a Cicero problem. It is not a Berwyn problem. It's not a Naperville problem. It's all of our problem, and we want to make sure our students feel supported.
It's such an honor that District 99 is taking the lead in bringing people together, not only school districts, but also agencies. They have a lot to share, right? We have a lot to learn from one another. So this is just the beginning.
Part of what we really want to do today is fight stigma, and simply talking about mental health can be a challenge sometimes. Bringing to the forefront knowledge and facts and people who are passionate about the topic will really help schools and community members start to understand this is a conversation that we can have and should have.
The WISC model, the whole school, whole community, whole child approach can be delved into through today's interaction by having roundtables of interdisciplinary professionals that can bring their perspective from what they've seen in their practice and discuss it.
I was really excited that something like this was going on, because I don't think there's a lot of this conversation that happens within the communities as a whole, like coming together and talking about all the different schools that are doing it and all the communities and what they need. And so figuring out what's going on at school and how you can help those kids, you know, not only in school but outside of school, and help the parents.
For an event of this magnitude to be successful, it truly takes collective vision, collective passion, and a desire to truly work together to move forward.
We have lots of resources that we want to leverage in our community and build strong partnerships to address mental health issues, suicide prevention, and stigma in our communities. We know that there is a need in our community from the work that we do. We hear it every day from schools. And so it was almost a no-brainer for us to create a platform to have this discussion.
I interact with a very wide variety of schools. I've been lucky enough to have the opportunity to work with Dr. Ryan and Mrs. Krieger and recognize that they are at the forefront of developing protocols for the district, and more than that, they have the passion and the drive. As a result, it just seemed like a natural fit that we would be able to work together. No one school district or no one organization is the master solution. And so it's essential that we bring more people to the conversation, and we're hoping through this activity that more schools and organizations will join us and that we will have more roundtable events in the future with a bigger planning committee.
We're seeing a lot of anxiety and depression, I would say would be on the top end, as well as non-compliance with school, which goes into the mental health factors.
There's a variety of concerns when it comes to students' mental health. We see a lot of kids have faced some kind of trauma. A lot of our kids have the inability to sometimes express how they're feeling or know how to cope with what they're feeling. It is our job as educators to help support them, because again, if kids are facing trauma and facing precipitating factors, they're not going to learn in the classroom.
I think a lot of times families look to the schools as caretakers, as mothers, as fathers, and I think because of that, kids sometimes feel more comfortable going to someone within a school versus telling their parents. And so for us, when mental health hits a student, it's things that they might, we want to make sure that we have our staff trained in knowing how to deal with those situations. And our kids come with such a variety, anywhere from cutting to depression to anxiety to something they experience, a traumatic experience at home.
The onset of mental health conditions has begun at earlier ages. Some of the effects of depression are seen very early on in our early elementary school students. Some of the things that we see with anxiety in the school setting can be related to test preparation, peer interaction, and ineffective communication with their peers.
What we're hearing from schools that we work with on a regular basis is that there's an increase in students who are experiencing anxiety. And these are not just students who have a chronic mental illness. These are high achieving students who are struggling because of social media influence or expectations at home or expectations from their community.
We try to be responsive to the needs of the community. And recently there was a death by suicide in a local school district. And so the school reached out to us, and we were able to leverage our staff, our clinical staff, and our expertise to respond to that school. And we had staff out there, in addition to the supports that the school already had, they needed additional help. And so since that time, there have been continued involvement of our team in the community and how we can continue to support the community, and what other organizations do we need to pull into the community so that we are, again, creating healthy communities, reducing stigma, empowering, families to have conversations about mental health and suicide prevention.
Sometimes it's difficult, I think, with parents to get them involved with things, because there are a lot out there that really want the help, and I think it's still the stigma of, my child is dealing with anxiety or depression, but that's not my kid.
The challenges that students face in today's society are accelerating mental health symptoms. And one of the things that is very challenging to talk about is also suicide prevention. So we really want to bring light to the fact that certainly these things are happening, but we want to stop operating in silos. And we really are hoping that by bringing together school representatives and community agency representatives, that they can start to recognize and see, wow, we have some pretty strong partnerships already. How can we continue to enhance this?
We know that in order to build a whole child, we need to be very aware of their needs. Those basic needs start with social-emotional, right? Making sure that they're stable, making sure that we do whatever we can to prevent kids from having issues. So it's important. It's important that we make this part of our day-to-day operations and embed it into the educational system.
We had actually decided to partner closely with Alyssa's Mission, who is actually here today at the Roundtable. They're participating today. And we talked a lot about how we really can consider our why, supporting parents, supporting schools, supporting children. And we decided to look at our technological resources. And we currently provide level of care assessments, but we said, how can we use these technological resources to advance what we're trying to do?
I had several people come to me and say, I didn't realize nurses in schools can really build on this. Some of what's been brought up has been crisis in schools, and some of the things that we've seen nationwide in violence, and really having a community approach, not just focusing on what's occurring in the school setting, but also looking at the incidents within the community as a whole.
Hoping that from this, these other buildings, these other districts, these other community members that have come from all around can now say, yes, we want to be a part of this. We want to then have more of these and make more of these events and focusing on different topics of mental health. And so that'll allow us to be the leaders, and we can then start generating more of this to support a lot of different areas of mental health.
Just seeing all of these people come together, it makes it more of, it's an everybody issue. It's not just a one kid issue.
If we can educate our community, our children, our faculty on some of these strategies, I think we can be very, very preventive.